Long axis distraction of the mortise joint.
Si, senor.
Long axis distraction of the subtalar joint. A to P, P to A, glide of the distal fibula. I to S, S to I, glide of the distal fibula. Inversion and eversion of the subtalar joint. A to P, P to A, shear of the mortise joint. A to P, P to A, shear of the subtalar joint. Tarsal, metatarsal, glide. Pick one phalange, motion palpation, and perform 5 moves. A to P, P to A, glide of the proximal tibia. A to P, P to A, glide of the proximal fibula. I to S, S to I, glide of the proximal fibula. Medial and lateral shear. Medial and lateral collateral ligaments. Internal and external rotation of the tibia. Patella motion. Knee distraction. Now onto the hip. Extension. Distraction.
Go ahead and flip over.
Flexion. Internal and external rotation of the hip. Posterior glide. Muscle testing. Glute medius muscle test.
Alright, hold this right here. I'm going to try and push it back in towards the other one. Good.
Navicular muscle test.
Alright, hold this one. Try to push it down towards the floor. Good.
Quads muscle test.
Go ahead and let both your that. Alright, kick up towards the ceiling. Good.
Rectus femoris muscle test.
Hold this right here. I'm going to try and push it back down.
Tensor fasciae latae muscle test.
You'll go make sure your hands aren't touching yourself. Alright. Hold it right there. I'm going to try and push it back towards your other foot. Good.
Foot and ankle. Pronation protocol. Navicular. Cuboid. Cuneiforms. Metatarsal heads. Talus. Calcaneus. Phalanges. Fibular head. Supination protocol. Navicular/cuneiforms. Cuboid. Metatarsal heads. Talus. Calcaneus. Phalanges. Fibular head. Alternate talus, supine. Alternate talus, prone, using the table.
Scoot towards your head a little bit for me.
Alternate talus, prone, knee flex. Great toe technique. MTP or IT?
Garcias.
Now onto the knee. Knee assessment. Medial condyle, wrist extension.
You need to flip over.
Medial condyle, wrist extension. Lateral condyle, wrist extension. Posterior tibia, wrist extension.
I would just do medial and lateral.
Medial condyle, prone, knee flex. Lateral condyle, prone, knee flex. Posterior tibia, prone, knee flex.
Same thing, just medial and lateral.
Patella, assess and correct.
Alright, go ahead and flip over for me. On a decrease in inferior glide, and I would just impulse into it.
Now onto the hip. Anterior femur, wrist extension. Anterior femur, posterior glide. Assess and correct. Hip internal rotation.
If I had a decrease in external rotation, then, or internal rotation, then I would take it, externally rotate, and impulse through it.
Assess and correct. External rotation.
So if I found a decrease in external rotation, then I would take it and impulse through internal.
Mission complete.